Hello, it's Caitlin. Today I'm speaking about the Emergency Medical Technician, or EMT. I was EMT in Orange County, California. I am currently enrolled in graduate school pursuing a degree in physician assistant studies. So, talks about the EMT career. 2016 median pay was $30,670, and median pay hourly was $15.71. And the typical entry-level education needed to pursue the career, the post-secondary non-degree certificate. So you basically need a high school or something equivalent like a GED, and you need certification. So you need to take a course to get certified as an EMT. And work-related experience that you need to become an EMT, and no on-the-job training. And there are 241,200 jobs, and the outlook for 2014 to 2024 is 24%, which is much faster than the average. So for this field between 2014 and 2024, as I said in the previous slide, is 24%, and this is according to the Bureau of Labor Statistics, which is a much faster rate of job growth than average for other fields. The Bureau of Statistics estimates more than 58,000 changes in EMTs and paramedics employment status over a 10-year span. And what this basically means for EMTs is that there's going to be job openings for future EMTs. EMTs do emergency technicians, EMTs, like I discussed, and paramedics care of the sick or injured in emergency medical settings. People often depend on the quick reaction and competent care provided by these workers. EMTs respond to emergency calls, perform medical services, and transport patients to medical facilities. Most medics work fully. Their work is physically strenuous and can be stressful, sometimes in life or death situations. And to talk about this topic a little bit more, there are a lot of resources provided for EMTs through your company. I know that my company provided like a hotline if you saw a situation that was kind of to deal with maybe a death or something of that sort, and it really affected your well-being. You always call this hotline and get some help and get a counselor or someone to help you through that tough time. So there are types of EMTs that you can become. A 911 responder is an EMT that really responds to 911 calls and assists medics. So in this, usually for the county that I worked at, I was not a 911 responder, but I did speak with a lot of other EMTs. So the company that was contracted with the city. So that company, those EMTs would respond to a 911 call, and when they got there, the fire department, along with paramedics and police or whoever was needed was already on scene. So basically, as an EMT, assist the paramedic in whatever he or she needs in the moment in order to help the patient and in order to safely transport them to this emergency room. And next is the interfacility transport, and this is also known as IFT. What I did when I worked as an EMT, and basically is someone who transports patients between medical facilities, nursing homes, or hospitals, and my company was actually contracted through a hospital that had 2 different buildings. So I would take patients to and from their procedures and different scans like a CAT scan or MRI. I would take them to and from their procedures and their rooms. So I came in a lot of contact with different patients throughout the day. And this exposed me to a lot of other persons in the medical field. And I got to talk with a lot of hospital staff, and it just helped really good connections. I actually recommend people who are interested in becoming, like, let's say, a doctor or a physician assistant or nurse. This is the type of EMT job that you might want to do because you have more exposure to patients in the hospital setting. Now, if you wanted to become a firefighter, paramedic, or be part of the emergency medical services, then you would be an EMT that is a 911 responder. So based on your future goals, you could determine what type of EMT job you want. And one, an event EMT. This is usually like a side job some companies will offer. So some attend these events like music festivals or fairs or something of that sort, and you basically work the tent. Basically, they need you, and then whenever someone gets hurt or they need help, you can go and assist them. So some of the skills that you will learn being an EMT, and I got into some of the specifics of the side of things just to show like what you could potentially learn to do and just what's helpful for future growth in the medical field. So learn what is called basic life support, which is included in the following bullets. So one is maintaining and opening an airway. So like mouth on something, will learn how to clear their airway so that they can breathe again, which is pretty important for life. And pulmonary resuscitation, which is also known as CPR. You need to know how to do this. And also these skills listed here are part of the skills final. So they test you on these skills in order to get national certification. So that means that everyone who is an EMT can perform these skills. Basic wound care, like bleeding control. If someone is bleeding, then you have to stop the bleeding and care for the wound. And then a certain medication, this depends on which county you work in. Some counties will allow you to administer than others. For Orange County, we were allowed to administer nitroglycerin, which is a medication that helps pain for some people, and we were allowed to give that if it was prescribed to the patient. And then you have to give certain things like help with people's injuries and things like that, but nothing big like IVs or anything. That's more of a paramedic skill or advanced life support rather than a basic life support skill. And then how to lift and move bodies. This is a really important within the EMT job because you have, which is basically a rolling bed that you take everywhere with you, and you have to learn how to safely move a patient from where they are to your gurney. And you don't like a lot of people have back pain or their fractured bones, then you aggravate that. So you have to learn how to safely do that, and you don't want to hurt yourself. So you learn proper lifting techniques when you become an EMT because it is a big part of our job. To assess a patient, both in medical and trauma situations. So a medical situation would be like dizziness, or if they have diabetes and they have high blood sugar and they're feeling weak or something. And it's more of like if someone gets hit on the head, or there's like an accident and they fall, that's more of a trauma assessment. So you learn the situations and skills that you need to assess the patient and do whatever's necessary to get them to the hospital or get them the care that they need. Learn how to deliver a child, but not all of us do that just because training, I was told that there were so many hospitals close by that it's faster just to take in labor to the hospital. But if you have to deliver a child, you do have the skills to do so. It's not very common in our field because parents probably do that also. Learn major disaster training, just in case if something happens, you have the skills to assess patients and determine whether they need help right away or they can wait a little bit until you see other people. So this is the skills that you need. And so like I said earlier, you'll need a high school diploma or something equivalent like a GED in order to enroll in an EMT program. And to be an EMT, you need a certification and state and county licensure. So the difference between certification and licensure is certification is national. And the national certification for EMTs is done through the National Registry of EMTs, which is NREMT, and that's a big test that you're going to take online or at a facility to get actual EMT certification. And then state licensure. Licensure means that you're basically licensed through your state or by county. So it's regulated by the state or the county and not nationwide. It's not regulated nationally. And really the class you take will do the state and county licensure as a part of the course. So I took my classes in Orange County, so therefore I received information I needed and took the proper tests that I needed to get Orange County licensure and my state of California licensure. So that's into that. If what county you want to work in, you take a class in that. If not, you can always take like a day course to get certified in that county or like an on course. It depends on the requirements needed. But yeah, certified classes, the training programs range from 2 to 6 months. Mine was an accelerated course, and that lasted about 4.5 to 5 weeks. But it was class from 8 to 5, which is a very intensive program, and you do receive a lot of information. So if you don't have any prior experience in the medical field, I would suggest taking a longer course. And usually the longer courses are offered at like community colleges and universities, but they are offered at some private technical schools also. I know community colleges offer like the semester, I think it's like the 3-month course, which is also pretty helpful, especially if you're new to the medical field. On this page, there are also a few resources that you can check out to get national certification. All the information you need basically to take that. And the thing I would pay close attention to is online courses. Sometimes schools will offer a hybrid course, which is half online, half in class. And I don't think that you can take a full online course because, like I said, they test you on the skill needed to be an EMT. So you do need some exposure to skills and practicing those, and then being comfortable with them so that when you do take a test, you know what you're doing and you pass it the first time. So my school actually included the national skills test as a part of our final. I didn't have to go anywhere separate to take the skills final. It was just a part of my course, and they did give us a lot of training in class on skills, and we got to practice and play with the different things needed for the skills. It was really helpful. Two advantages and disadvantages of the career. Advantages, you make really great connections, especially when you're working like ISP, like I did. You make a lot of connections within the hospital. So I work with a lot of nurses. I got to speak to them. They get a lot of great advice. And then working in the 911 field, you get to make a lot of connections with firefighters, policemen, and different people within the emergency medical services. So a really good thing if you're wanting to grow within those two fields. It's challenging, especially for 911 responders. You have to think on your feet, and even with the IFT, you know what a patient is going to say or do, and if you're going to have to put them in machines, maybe they're on a psychiatric hold, you're never going to get. So that's very challenging to deal with, and it's you on your toes, which is really a cool thing. It's very. I have a lot of patients that really appreciate my work, and just getting to know them and being very personable with them, you really impact their lives, and especially a very dark time for them. Maybe a hospital is not really a place for them, so they get kind of scared, and you being there for them and providing some emotional support is very rewarding to see, and it's nice to help people out in that way. You have a lot of useful life skills, not only like the basic life support skills that I told about, but different life skills like how to handle stressful situations, or how to people maybe are not reasonable, and just different things like that you could use in different aspects of life or in a different job if you plan to progress. There is low pay, but I know that things will give you a bonus for being there for a certain amount of time. As you get more experience, you do get paid more. And this career is more of like a stepping stone to other careers. So we become EMTs to expose themselves to different careers in the medical field, and also to get like kind of a start on other things, like become a paramedic or a doctor, PA. Long hours. When working, I worked 12-hour shifts, and I know there are some 24-hour shifts. But about this is that you have more days off. So I only worked 3 or 4 days a week, and then I would have the rest of the days off, which was kind of nice. It was actually almost an advantage, I think. Working 12-hour days is definitely pretty good, but I think it's well worth it. Stressful. You do develop ways of handling stress, which is useful in life. But if you ever do need to talk to someone, most time your company will provide those lines that you can dial in and get some help. Exposure to diseases and situations. I think this is true for most. In medicine, you are exposed to a lot of diseases and a lot of things you'll have, but they teach you how to take standard precautions and how to protect yourself against diseases and different things and situations, especially 911 responders. Going to someone's home, you don't know if they're hostile, or you learn different techniques to protect yourself, because the most important thing is protecting yourself so that you can help your patient. So you do gain the skills necessary to protect yourself from these dangerous situations and how to approach them. So, yeah, that's all I have for you guys today. If any questions, I can answer them now.
No questions. Thank you for Caitlin for all of your information, and thank you for presenting for us today.
No problem. Have a great day.
You too.